Dear students, welcome to R.A.T.S in Pathology, Racing Against Time for Students in Pathology. And the topic for the day is wound healing. The importance of it is given in the enclosure, and it shall cover multiple subjects including pathology, surgery, orthopedics, and whatnot. Let us get familiarized with the terms. When such a question is asked, we should cover the types of wounds, incision, laceration, ulceration, an infected wound, granulation tissue, primary healing, secondary healing, factors affecting wound healing, complications. Moreover, there can be other modalities of wound. So these should be borne in mind because they might be independently asked as questions. For example, the granulation tissue, or primary healing, or secondary healing. The types of wound healing include primary healing, secondary healing, fracture healing, and healing in specialized tissues. For the day, I shall be covering primary and secondary healing alone. Let us understand the terms. Definitions are definitions. A wound is defined as a defect in the epithelium and the subepithelial tissue caused by a trauma, which can be intentional, deliberate, as a surgical incision in this case, or it can be accidental also. Sometimes a blunt wound might damage an underlying organ, whereas the overlying epithelium might seemingly be intact. There are certain allotted terms accordingly, which we should be seeing. One is repair, another is regeneration. Regeneration is the replacement of the lost tissue by the original type of tissue. For example, the squamous epithelium is replaced by squamous epithelium. Whereas repair means it is a larger defect and then there is a replacement by fibrocollagenous tissue leading to a scar. These terms can also be applied to parenchymal organs such as the liver, which we shall be seeing in a different context. Now, what are the types of cells? Before we go into it, we should be mentioning the types of cells. They are the labile cells. What are the labile cells? They are cells in a constant state of multiplication. Whether we want or not, they keep multiplying. The classical example will be the bone marrow. Cells are lost and then they are being replaced. Another one is the lining epithelium. Unconsciously or without anybody's knowledge, they are being shed and they are again being replaced. Such are the labile cells. Stable cells, on the contrary, undergo mitosis and replace the lost tissue only when it is required. The best example is the liver. It has got an immense multiplying potentiality, but it multiplies only when it is needed. Permanent cells cannot multiply, and the best examples are the myocardium, the heart, and the brain as well. In such cases, it is being replaced by fibrosis. If this was not the case, the cardiologists would have lost their importance. And this is the story of Prometheus. I do not know what mistake he made, but then as a punishment, he was chained onto a cliff. And every night, an eagle used to devour part of his liver. And when they thought he would be dead, went there to see him, the liver had regenerated. And that is the story. So that indicates the multiplying potential of the liver. This happens in many a condition which we would have already seen in hepatic pathology. Whatever be the type of wound healing, we should understand the basics first. And this is a very nice diagram which you people can simplistically draw. There is a lining epithelium, and this is the defect, and subsequently there are some stages. Initially, you find this red color indicates a blood clot or a hematoma formation. Along with it, immediately, there will be the inflammatory cells also which come into the region. You find that the inflammatory cells are coming into the region along with the RBCs, platelets, etc. Later on, there is a proliferation of the fibroblasts, neovascularization, etc., which will be forming what is called the granulation tissue. Simultaneously, I find that, see, this is the epithelium, this is the basement membrane of the epithelium. It continues to grow. The hematoma, it gets shrunken, and beneath that, the basement membrane grows, and the epithelium is relaid over it. Finally, you find that there is a defect which can be replaced by a scar. That is shown by the meshwork of fibrosis that is over here. This is a basic concept, so I would like you people to understand this. This can be applied to primary healing, secondary healing, etc. This is extremely important, the granulation tissue. Important in the sense, sometimes when this is asked as a question, the students write granuloma. And when granuloma is asked, they write this otherwise. And this is a large defect that we are seeing. And then there is a bright red color that is staring at us. And that is the granulation tissue. What is it microscopically? You find that this is the granulation tissue, a superb diagram from Alami. Credit goes to them. This is the stroma inside, and there is an edema. Initially, you people would have observed, whatever be the surgery or anything, there is a swelling of the tissue that is due to edema. Then, as we had mentioned, apart from the epithelium, there is a proliferation of spindle-shaped cells. These are fine cells, elongated nuclei, tapering ends. They are the fibroblasts. You can call them as predecessors or precursors of collagen. So we have seen fibroblasts, we have seen edema. Then, as we had seen earlier, there will be the inflammatory cells. All these dark dots are the inflammatory. All this needs some kind of a vasculature, and that is called neovascularization. This is a larger blood vessel I am seeing. There is an emigration of the inflammatory cells. At the same time, I am finding that there are smaller capillaries which are proliferating. This is called as angiogenesis or neovascularization. So when I say granulation tissue, it is composed of fibroblasts, edematous stroma, inflammatory cells, and proliferating capillaries. So this itself can be a university question for you. This is a histological picture, a fundamental, though it is a little difficult for the students. I find that there are a lot of easier things first. I'm finding this blood vessel. Look at this one, this fellow is branching. So there is a sprout that is coming out of the main vessel. This is called neovascularization. And look at the dark dots. Concentrate only on the dark blue dots. It is less in this region, more in this region. They all indicate inflammatory cells. And not to the magnification, I could be able to see some spindle-shaped cells, which are the fibroblasts. Also in this region, it is appearing pale because of edema. So this is the granulation tissue. It is given over here, proliferating capillaries and branching, angiogenesis, fibroblasts, collagen fibers at a later stage, inflammatory infiltrate, and edema. Primary wound healing. This can be asked as a question by itself or can be part of wound healing. Some books call it as healing by first intention. This happens in a case of a clean surgical incision. So this is a surgical incision, and I find that the margins are being pulled apart so that the surgeon has got a better field of surgery. It is clean, it is straight. Those days, the professors used to say, longer the incision, better the surgery. But now the concept is otherwise with laparoscopic surgery. Whatever be it, I find that this is it. This particular diagram I would like you people to draw. And my professors used to say, longer the incision, better the surgery. Now there are other schools of thought with the laparoscopic surgery. Look at this diagram as such. This is a stratified epithelium. There has been a very straight incision, and after the surgery is over, it has been sutured. Classical of the surgical incision. There is a narrow defect. The edges are opposed, placed side by side. Hematoma formation will be minimal, and there is a neutrophilic infiltration. Please draw this. The same thing is over here. The healing by first intention and continuing. So there is a hematoma. You find that this red one indicates RBC, which means a blood clot. And immediately it fills, it dries, it seals. So this is the first mode of protection by the body. Whatever be the wound, the body attempts to cover it. Later on, you find that the hematoma gets shrunken and there is a regeneration of the epithelium. Simultaneously, lower down, there is a neovascularization and there is a replacement by fibrous tissue. But in this case, I am finding there will be only a narrow band of this fibrosis. The adnexia will be lost in this particular region, but not otherwise. These regions will be having a normal dermal appendages, after which I find that the epithelium is almost normal as before. So this is the explanation. There is a narrow defect filled with blood and a hematoma. Within 24 hours, there is an infiltration with polymorphs or neutrophils. Simultaneously, there is a proliferation of the basement membrane and the epithelial cells along with. After the third day, the neutrophils are being replaced by the macrophages. Those are the scavenger cells which will be removing the debris. And finally, the granulation tissue that we mentioned earlier will be filling the defect. Don't mistake the granulation tissue with the hematoma. You must draw this. This is a superb diagram, and I'm again re-explaining. So there has been a wound, there is a clot, there is a scab, it gets dried. So further infection is prevented for the time being. It is not a good permanent measure. After some time, I find that platelet and fibrin will be there and it gets almost sealed. There will be the inflammatory cells as we are seeing in this picture. It comes and the scab gets dried, the clot gets withdrawn. The epithelium, there is a proliferation, and I find that there is a regeneration of the epithelium. First, the basal layer alone multiplies. Then it is able to be replaced by the entire thickness. It can proliferate, replacing the entire thickness. And below that, there is a fibrocollagenous scar. On both sides, I am finding the neovascularization. Look at the fine branches over here. These spindle-shaped cells are the fibroblasts, and the broad bands of tissue is the collagen. Very good diagram, easy for you people to draw. It will fetch you marks. Again, the same one being explained. I will not go into the finer details of it. I would like you people to kindly practice. So there can be neovascularization, scarring can be present, and epithelial proliferation is complete. Now, what is a dead space? Dead space is a separation of the wounded disc, which have not been completely approximated. So there will be some kind of air or something which will not allow the blood to collect, and it can lead to infection. That is dead space. And this is some kind of a quote that I picked up. See whether it interests you. Maybe in a different context of a woman or something. Do you want to be a wizard? Differences It may be asked, it may not be asked. Healing by first intention, healing by second intention. But it is our profound duty, whatever be the question, to write the differences. Because I get marks. Moreover, by reading the differences, I know two answers. So let me go to the answer proper. First intention, it occurs in a clean incise surgical wound. Second intention, on the contrary, large wounds due to trauma, ulceration, road traffic accident. There is hardly any loss of tissue, fine hair-like loss alone. Whereas here there is an extensive loss of tissue. Wound contraction does not occur, it is not taking place. So not much of fibrosis. Whereas here, contraction is very important. The size of the wound can be reduced as much as 80%. That is what your Robbins says. The initial protective mechanism is the contraction by fibrosis, so that the defect that can be replaced is reduced to 20 to 25%. There is a lesser amount of granulation tissue needed for repair, whereas here the bulk of the repair comes from the granulation tissue. So this is the second intention. Compared with the first diagram, I am finding a excavated cave-like defect. So obviously there is a lot of clot that is over here, and this will have to grow slowly and then it will have to multiply. In the meantime, what will happen is there is a lot of this fibrosis which fills it, and also it goes into the gap over here. Therefore, ultimately, you people will be having some kind of scar in your body. Just analyze why it occurs. That is because the scar tissue formed faster than the epithelium closes. So it is a larger wound, unopposed edges. It happens in ulcers, excision of a nodule surgically. Sometimes when they do it, there will be such a defect. It can happen in infected wounds, road traffic accidents, etc. Please draw this diagram. Again, a super picture to be drawn. Healing by second intention, also called secondary healing. The initial phase, the wound is filled with clot and it dries. Wound contracture, so that it is reduced to about 1/3 to 1/4 of the original size due to fibroblasts. There is epithelial proliferation similar to type 1. Not possible due to the large wound. The defect fills with fibrosis. So quote about intention, we have been talking about primary intention and secondary intention. Good intentions are useless until they are expressed in appropriate action. Napoleon Hill, he is actually an author who gives a solution in devastating times. Probably he will be a good bet for your students to lean on when you go towards the examination. A very wonderful diagram which I had taken up, colorful also. Kindly go through it. An excavated wound, there is a large defect, epithelium is separated, it cannot be opposed by means of suturing. So there is a clot that is getting formed over here, and look at the exuberant growth of the fibrous tissue. All these elongated ones are the fibrous tissue, and it grows and fluxes so that the epithelial ends are not able to meet. Finally, you find that there will be an overgrowth by a slender one, but the predominant defect is being covered by fibrosis. Initially, it is haphazard, but later on you find that they are all more parallelly arranged. And along this entire defect, you will not be finding a single appendage. So there will be loss of appendages in this particular region. This is a subcutaneous patch, this is the dermis, and this is the epidermis. So granulation tissue is abundant, leading to fibrosis, neoangiogenesis, new blood vessels, as in the case of primary intention. Scar tissue is due to fibrocollagenous tissue, and the appendages are lost. Again, another one I would like you people to practice the explanation. There is a hematoma formation, there is a defect, and then there is a growth of the granulation tissue and fibrosis, which ultimately covers it. The epithelium is not allowed to meet. Now we have come to the end of this particular session. Our answer is incomplete because it lacks growth factors, factors affecting wound healing, complications of wound healing, healing in specialized tissues, all of which are university questions, and answering this will get you more marks in the first half also. So please always see the second half of my classes, which students are avoiding. The second half will get you more marks. The question that we omit is our university question. IQ is equal to UQ. To be continued.